I wondered why decisions were being made, clinical, administrative, that led to the deaths of patients. I wondered about Lovelace. Where did the name come from? When I worked in the downtown hospital in 1998, it was St. Joseph's. In 2005, it was Albuquerque Regional Medical Center. A year later, it was Lovelace Medical Center. Before it was Lovelace Women's Hospital, it was Northeast Heights. Was there something in names, something in the past, to explain things? I knew we were owned by a company called Ardent Health Services, that it was based in Nashville. I found a book, The Lovelace Medical Center, Pioneer in American Healthcare. It was written by Jack Speidel, a professor in the history department at the University of New Mexico. It was a thread that slowly unraveled the mystery, explained what happened and why. I began to write. You write to understand. Annie Dillard says, when you write, you lay out a line of words. The line of words is a miner's pick, a woodcarver's gouge, a surgeon's probe. You wield it, and it digs a path you follow. Soon you find yourself deep in new territory. Before I wrote this book, I didn't know about leveraged buyouts, OpCo-PropCo deals, dividend recapitalization, tax arbitrage. I didn't know who Randy Lovelace was. I found them on the path. The story of the Lovelace health system in New Mexico is the story of an institution that began with one man and a vision of service, of a mission-driven hospital that became a transcendent medical presence in the Southwest. It is also a story of fallen glory, of how that vision died in the hands of Wall Street. In Murder Most Foul and the Haunting of America, Timothy Hampton's review of Bob Dylan's song about the assassination of John F. Kennedy, the author talks about the struggle in American literature to grasp and comprehend larger political and economic forces, and the spiritual and moral changes in daily life wrought by them. Artists, Hampton writes, are sometimes able to grasp these forces through small flakes of experience which gestured, allegorically as it were, to the larger catastrophes of our national life. The small towns of Faulkner, the paranoid communities of Pinchon, the tangled but discreet cases of Raymond Chandler, all reflect beyond themselves onto the guilt, corruption, and greed that power our national political progress and economic growth. This book is about my last year in nursing, a small flake of experience.